So now let's turn to Swati, Swati Adarkar, and we can get you unmuted, and Tyler is pulling up your slides. So welcome, we're looking forward to hearing from you. She is President and CEO of the Children's Institute in Portland, Oregon.
Thank you so much, Chris, and to the National Press Foundation for today's invitation and the opportunity to connect with the journalists and other people who are participating in the webinar. As a person who has a communications background way back when, I just couldn't underscore anymore how important the role is for the folks who get this information out, so we get a wider circle of folks elevating the priority of these issues to the broader public. I also want to give a thank you to Jack, whose work has over multiple decades shaped the career and work of people like me all over the country, and we continue to try to step up to the evolving science, which he and his colleagues at the Center for the Developing Child are helping us to think about how you take that research and move it to action. So thank you, Jack. My sort of understanding of poverty and what it looks like really started in my early childhood, because I am the daughter of Indian immigrant parents. And as a young child, made many trips to India, where I was for the first time in an environment where kids look like me. And I was seeing a lot of adversity in the description that Jack, the picture he painted. And going to and from India and the US, what became abundantly clear as a little kid was this inequity and inequality between what kids were experiencing in India and the lack of resources there, versus seeing kids who didn't have what I had growing up in the US, but abundant wealth and resources. And so as a little kid, I didn't know the research, but something deep inside me told me that was deeply wrong and that we had the means to solve the problem. So now 50 years later, I feel the same sense of urgency with a little more education and understanding under my belt, but quite frankly, I'm really at this point in my life feel like we've got to go beyond studying the problem. And so my passion for this continues, and I'm looking forward to sharing with you the work at the Children's Institute. So the Children's Institute was created 16 years ago. I had the pleasure of being one of the co-founders, and really what we were focused on is moving research to action. And our focus is on the early years of life. And we are a statewide advocacy organization committed to improving the early health and developmental experiences for Oregon's young children birth to 8. So it's very resonant with the research that Jack has been just shared earlier. We work across research, policy, communications, and practice. And if you look at the slide, we're really focused on 3 important building blocks for early health and educational attainment through the life course. The first is supporting healthy development, starting prenatally and for infants and toddlers, and then the early learning and developmental support so that children come to school programs in kindergarten really prepared for success, and that continuity that's critical into the early grades, that children can meet those important benchmarks at 3rd grade reading and math that tell us so much about the likelihood of them being high school graduates. I wanted to give you a picture of what child poverty looks like for young children birth to 5 in Oregon. This is the map of Oregon. I know Oregon's been in the news a lot lately. And while we've been hearing on the national news about racial uprisings and call for racial justice and the effects of climate change with extensive fires, the other critical emergency that's been happening year over year for a very long time is the effects of child poverty. And what you see in this slide it's a picture of Oregon's 36 counties, and the shading from light green to dark blue gives the variation in child poverty. And what we know in Oregon is that 45% of the children in our state, even though we have beautiful mountains, trees, rivers, and so forth, and parks, is that 45% of our kids are low income. That's about 24,000 kids. And 50,000 of those kids live in poverty at 100% of the federal poverty level or below. And of our 36 counties, 27 of those counties have child poverty rates above 20%. For me, that's just jaw-dropping because we know their early life conditions are not setting them up for the kind of success that we know is important. And a lot of that concentration of poverty is deeply impacted in rural and frontier counties. Oregon is a state with vast areas of less populated rural communities, but concentrated poverty. We also, as is true nationally, are seeing really shifting demographics, racially, culturally, and linguistically in Oregon. In the birth to 5 population with Latinx children, big increase, and that is, they now make up 1 out of every 5 children in Oregon. We also know that in addition to poverty, that Oregon has a very high homeless rate for children and families, actually twice the national rate, as well as a very high rate of food insecurity that's disproportionately affecting kids in the first 5 years of life. We know that that's very connected to supporting healthy brain development, and we know that things have gotten much worse since under COVID-19 for housing and food security. Next slide, please. I wanted to give you a snapshot of what poverty looks like by race. Well, the total number of young children birth to 5 in Oregon, the largest number are white, 32,000 out of 50,000. When you begin to look at the effects by children, looking at the different racial breakouts, what you see is that poverty is highest on children of color, really by a long shot. And you see Native Hawaiian and Pacific Islander children with poverty rates of 47%, African American children 45%, American Indian Alaska Native 41%, and Hispanic children 34%. These are very deep systemic issues that have to be attended to if we want children to be able to achieve their potential. Next slide, please. One way we go about trying to address the challenges that I've named is to try to increase the early learning opportunities and developmental supports for children, particularly during the prenatal to 5 period. What you see in this slide is the steps of advocates like the Children's Institute and others across the country to try to win public investments at the federal and state level for the kinds of programs we know can support healthy development and optimal learning. Some of those programs are here on that slide, but what you see on the slide also is such a tiny fraction of the eligible children are being served, even though the Children's Institute has had some really big wins at the state legislature. Really, there's huge research on home visiting programs, early Head Start, the effects of preschool, and of course, supporting quality childcare. But unlike the K-12 system, where kids have an opportunity beginning at kindergarten, the same is not true in the birth to 5 years. And in Oregon, if you look at the combined federal and state funding for 0 to 5, it's just less than 10% of the total education investment, and that's during the most critical window of brain development. So big challenge in terms of the return on investment opportunity versus the level investment. Next slide, please. We were really heartened by a recent really big legislative win pre-COVID in Oregon, which was a real milestone and marker of the progress that's been made in people understanding the need to invest in early childhood. And in part, that's happening among the legislature as well as a lot of school districts. a lot of folks who've been working very hard in the K-12 system are increasingly learning that they can't close these opportunity gaps and reduce disparities in health and education unless we really look at the birth to 5 years. And so we were in Oregon, led by gubernatorial leadership of our current governor, Kate Brown, and previous governors who've really supported early childhood, Governor Kitzhaber, for example, partnering with the legislature and champions there and advocates, passed a commercial activities tax. It's a new funding stream of $1 billion, which is really big in Oregon, and frankly, I believe really big in lots of states. And with that new $1 billion investment, it focuses on education initiative, focused on reducing inequities with a 20% commitment for early learning birth to 5. So that's $200 million annually every year. So we're going to start to see those bar chart on the previous slides. We're going to start to see some of those numbers go up for reaching eligible children. Next slide, please. That was called the Student Success Act, by the way, that last legislative victory. So as an advocate who for many years has been working on increasing investments, at our organization, we've known all along that resources are absolutely essential, but more resources doesn't immediately translate into improved child outcomes. We have a myriad of disparate funding streams at the federal and state level. We have a myriad of state agencies, and we don't have coherence or an early learning system that's connected and seamless for families. And so some of the challenges that Jack talked about is the administrative burden or hurdles for accessing programs continues to be a challenge. And so we were really curious at the Children's Institute, knowing that our goal was a seamless system of care services and supports for children from the early years through the early grades. What if we looked at that problem and learned what we could do to have an impact by understanding how systems work on a community level? And we were really interested in advocates because we believed that in addition to money, we needed to better unpack and understand what implementation looked like when it was working at a community level. And so for us, we really started digging in to connecting policy and practice. And the way we've gone about that is we launched a 10-year initiative to focus on these usually disparate pieces in deep partnership with 2 communities that you see up on the slide. The first community was Earl Boyles Elementary School in the David Douglas School District in Portland, Oregon, an urban area. The second community is Yoncalla Elementary School, a community 3 hours south of Portland, which is a tiny 1,000 person small rural town. To give you a little flavor about each of these communities, Earl Boyles, as I said, in an urban area, the school itself is a little over 400 children, and they are very racially, culturally diverse. One of the things I love when walking through the schools is you see the languages represented, and it really is like a tour around the world. There are children from all over the world there. And it's a very rich, incredibly wonderful linguistic environment when you walk through the school, and rich cultures and backgrounds. Earl Boyles Elementary School had a real excitement and readiness around this value proposition of an initiative that was to look at aligning 0 to 5 services with an elementary school. Most of our kids in Oregon go to public elementary schools. So we really thought it would be interesting to think about universal settings, to look at places where kids and families go in their day-to-day life, and what it would look like if an elementary school was a hub for accessing services in a very normal way, in which the way they bring their children to school, but to look at connecting to services much earlier, birth to 5. And so the Earl Boyles community was really excited to lean into that effort with us, and that started over 10 years ago. And we had incredible leadership ready to lean into that initiative, because the then superintendent, Don Grotting, and Principal Erica Ganay, who's still there, felt like their teachers were working harder and harder, but they weren't improving outcomes. So they were really interested, even though their background was not early learning, they were interested in learning about these services and how it could impact K-12 outcomes. The kids at Earl Boyles Elementary were coming to school 2 years behind their more advantaged peers. So that was a really big gap at kindergarten. We know when that is really entrenched in kindergarten that it's hard to turn around. In Young-Kala, the community had a lot more distrust of the teachers and the community. There was a lot more tension there. And so they were not ready to start with preschool services. And they said, we wanted to start with community baby showers, which is not an evidence-based service that we knew about, but we trusted the community and we went with that. And it's had amazing effect to listen to the community. Next slide. There's an array of services now that have been built there, built on public funding streams and blending and braiding those, that cross the 0 to 5 spectrum, from publicly funded preschool to parenting classes and workshops, play and learn groups, community events. Deep community relationships have built, lending libraries. Both facilities have been transformed to create developmentally appropriate spaces. The David Douglas School District passed a bond to help support this, a new early learning wing at the school, and there's services that really are comprehensive and connect to nutrition and community health. The other thing we're seeing by this 2-generation strategy is it's starting to influence parent employment and a potential pipeline in the early learning and health space where parents have been trained as community health workers. And parents have gone and got their CDA and are classroom assistants. We think those kinds of strong community relationships and buy-in are really key for transformation. The other thing we were really curious about in listening to the community was what research looks like when you empower the community to do the research. And so we dug into something called community participatory research, which we worked with Portland State University to train parents to go into the community and collect data. And what's been so powerful in this exercise is, first of all, we had a set of questions we thought made parents said those questions don't make any sense. We said, well, what questions make sense to ask the community? And they said, here are the questions we think make sense. We thought were way too personal, but they knew their community members and they could, in their community, go door to door and ask those questions. And what happened with communities is it elevated a set of issues that were really core to what the community thought was absolutely critical. In the Earl Boyles community, it elevated the need for stable housing and other supports for service navigation. And in Young-Kala, a town with 3 times health outcomes that are worse than the state average, they needed health services. And so the advocacy of the parents and the community members has led to funding for short-term rent assistance for the Earl Boyles community, and for a new satellite health clinic in Young-Kala that is started with 1 day a week and is now moving to 2 days a week. Next slide, please.
And Swati, I was just want to give you a heads up on time. We'd like to be able to get to some questions. So if you are able to move through these last couple fairly quickly.
Sure. So this last slide is, one of the last slides is looking at the impact at Earl Boyles specifically. We've been doing a longitudinal evaluation, and what you see is strong early literacy skills at kindergarten entry, gaps closing by race, which is a huge issue at kindergarten entry and literacy, less mobility, less moving around of families, and families staying in the district and at the school, and kids' literacy skills exceeding the district and state average, and reduction in special education costs. Next slide, please. What we've learned is that a 2-generation comprehensive approach to this and working across child poverty and early childhood is really the key to change, and listening to the community and inviting the community to co-design the solutions with us, and for advocates to take that understanding of program design and implementation to the state policy level. We know that addressing systemic racism and discrimination is key in this effort, and we really know that by listening, we can get further much faster with these outcomes. So thank you so much. I really appreciate the chance to talk with you today.